Traditional medicine in various countries is enriched with healthcare and national culture value. Strengthening the exchanges and cooperation in traditional medicine is of great significance to boost mutual learning, people-to-people exchanges in all countries. Here, I would like to share with you the topic of TCM development and its role in COVID-19 containment. The first part, current situation of TCM development. TCM is a treasure of ancient Chinese science. As a unique resource in health and culture, it has made great contributions to the Chinese nation and has positively influenced the progress of world civilization. The Chinese government has attached more importance on TCM and boosts the reform and development of TCM with unprecedented efforts to guide and lead historic achievements of TCM, as detailed in the following aspects. First, an institutional system has been set up to ensure the quality development of TCM. In 2017, the TCM Law of the People's Republic of China was passed, which was the first fundamental and comprehensive law of TCM. In 2016, the State Council issued the Planning Compendium of Strategic Plan for the Development of TCM 2016 to 2030. In 2019, the National Conference of TCM was held, and the proposals of the CPC Central Committee and the State Council on boosting the inheritance and innovation of TCM was issued. So through the above policies and regulations, the guidelines, objectives, tasks, corresponding measures for the development of TCM were identified. A number of reform measures have been launched, such as the registration of TCM clinics and the examination of TCM license for professionals with practical expertise. Second, both the capability and accessibility of TCM have been significantly improved. TCM is perfectly integrated into the holistic situation of health system reform and amplified the positive efficacy of the reform by providing more medical services with relatively less resources. As of 2019, there are 5,232 TCM hospitals with a total of 1.092 million beds. 98.3% of community health centers, 85.9% of community health stations, 97.1% of township health centers, and 71.3% of village clinics nationwide are able to provide TCM services. Third, both the inheritance and protection and scientific and technological innovation of TCM were accelerated. A total of 1,482 inheritance studios of national famous and experienced TCM experts have been set up, and 127 TCM projects have been selected as representative projects of national intangible cultural heritage. So the fourth National General Survey of TCM resources was carried out. Fourth, the cultivation of TCM professionals has been advanced. The 100,000, 10,000 inheritance and innovation project of TCM professionals, Qi Huang project, has been implemented. For national TCM professionals, 99 of Qi Huang scholars, 500 national outstanding TCM clinical professionals were selected. The evaluation and incentive mechanisms of TCM professionals have been further improved. 16 national TCM masters, 100 outstanding national TCM physicians were selected. As of 2019, there are 625,000 licensed, including assistant TCM doctors in health institutions, with an increase of 38.3% 2015. The second part, the significance of TCM in COVID-19 pandemic and control. TCM has played an irreplaceable role in public health emergencies and is an indispensable resource for the construction of a national public health system. First, TCM is a medical science that originated in China and has played an important role to combat disease for the Chinese nation. Historically, the Chinese nation successfully survived hundreds of large-scale plague, but was able to turn the tide, which can be largely accredited to the protection of TCM. In recent years, application of TCM in the prevention and treatment of emerging infectious disease, such as SARS, H1N1, Ebola, have also achieved remarkable progress. Second, TCM has been thoroughly involved in the whole process of China's domestic fight against COVID-19. After the outbreak of the pandemic, TCM forces across the country were mobilized to support the Wuhan city of Hubei province. So nearly 5,000 TCM professionals from about 700 TCM institutions fought the epidemic on the front line of Hubei. So NATCM immediately organized and sent a national Chinese medicine specialist team to Wuhan, Hubei province to fight the pandemic. 5 groups of 717 national TCM medical teams were established to take over 8 wards and the Jiangxia Cabin Hospital, as well as other 3 hospitals, exploring novel diagnosis and treatment mode, distinguished by TCM characteristics with integration of both TCM and modern medicine. NATCM timely released the results of clinical research and successful screen out of TCM products, represented by the 3 drugs and 3 formulas. The third to 8th edition of national diagnosis and treatment protocols characterized by the integration of TCM and modern medicine were jointly issued by both the National Health Commission and NATCM. TCM treatment was formulated for various types of patients, either in the medical observation period or in the mild, severe, critically ill cases or discharged cases as well. The comprehensive participation of TCM significantly diminished the morbidity, the rate of progression to severe disease and death rate, and simultaneously increased the cure rate and accelerated the recovery in the convalescence period. According to statistics, the TCM involved cases accounted for 92% of the total cases diagnosed with COVID-19. The involvement of TCM ensured major strategic achievements for the national epidemic prevention and control. Third, the humanitarianism was advocated to help build a community of health for all. In 2020, the NATCM supported more than 110 virtual conferences to share the epidemic experience and practice of TCM and traditional medicine, TCM diagnosis and treatment protocols, effective formulas, and through international organizations and bilateral mechanisms, clinical experience were widely shared to more than 150 countries. TCM physicians were sent to 28 countries and regions to help fight COVID-19. These measures have been widely welcomed by the international community. So the third part, the international cooperation of TCM. So at present, the spread and influence of TCM in the world is expanding, and it has spread to 196 countries and regions. TCM has gradually integrated into the international medical system, and TCM drugs have been registered in countries such as Russia, Cuba, Vietnam, Singapore, UAE. So in terms of supporting the development of international traditional medicine, the Chinese government is committed to promoting the international development of traditional medicine, maintaining close cooperation with the World Health Organization, and contributing to the development of global traditional medicine. At present, the Chinese government has signed special TCM cooperation agreements with more than 40 countries, international organizations, and regional authorities. In terms of TCM foreign aid, China has sent medical teams to 69 countries in Asia, Africa, and Latin America, and TCM personnel are included in almost every medical team, accounting for about 10% of the total medical personnel. These TCM medical personnel have saved the lives of many critically ill patients and have been fully recognized by the governments and the people of the recipient countries. The fourth part, prospect of the future. First, we will inherit the essence of traditional medicine and keep up with the innovation so as to promote the academic development and prevention and control ability of traditional medicine in various countries. The demands for disease prevention and control should be addressed by further inheritance of the essence of traditional medicine through its development and highlighting its special advantages, as well as the innovation of both theory and practice of traditional medicine by taking advantages of the modern science and technology. Regarding engagement of TCM in public health emergencies as a breakthrough, China is willing to cooperate with other countries in order to promote the successful transform of traditional medicine, including the TCM, into a reliable global public health product and a booster for a community of health for all. Second, we should adhere to the principles of communication, cooperation, and mutual learning so as to distinguish the unique advantages of traditional medicine of various countries. So in order to make the full use of traditional medicine, all countries should cherish its value, attach importance to its rule, and jointly establish a set of policies and regulations that are conducive to its application and development. Therefore, we should constantly strengthen international exchanges and cooperation in this area through establishing effective mechanisms and platforms for professional institutions, enhancing mutual visits. Third, we should work together for shared benefits and contribute to a community of health for all. The NATCM are willing to make joint efforts with all parties to increase information sharing on traditional medicine prevention and control of COVID-19 and strengthen international exchanges and cooperation on traditional medicine within the policy framework of the World Health Organization. China is willing to continue to share the experience and practice of TCM to fight COVID-19, strengthen the training of TCM professionals in countries as requested, actively promote the use of TCM diagnosis and treatment expertise so as to benefit more people and make greater contributions to the community of health for all. Thank you.